Okay. This is the demonstration video for a female catheter insertion video. Uh, First step we're going to do is review the medical record to make sure that there's no diagnoses or allergies that would prevent us from completing the procedure. Assuming there's no allergies or diagnoses preventing us from doing the procedure, we're going to assemble our equipment and supplies. We're going to knock on the door. We're going to provide for privacy, wash your hands, acknowledge the patient. Hi, Mrs. Smith. I'm Robert, your student practical nurse. If you would do me a favor and give me your first and last name, your date of birth, and any allergies you may have. Assuming she's correctly given me her ID, her date of birth, and any allergies, we'll go ahead and proceed with the procedure. Mrs. Smith, I'm going to go ahead and have an order to, I'm going to explain the procedure a little bit too, but I have an order to insert an indwelling catheter, which is a catheter that we will insert into your urethra, will assist with any urinary retention or prevention of UTIs during your stay. At this point, we're going to raise the bed to our working height, lower the head, and lower the rail. We're going to wash our hands and apply, which we've already done, and apply clean gloves. Examine the patient's bladder for any distension or pain. None is reported. At this point, we'll also provide ordinary, the basic perineal clean of the perineal area. We'll wash our hands, put on our gloves. We're going to spread the labia with our hand, have a clean cloth. Spread the labia clean front to back on the patient's left side, front to back on the patient's right side, inside the labia, and then straight down the middle. We can repeat those using clean corners each time. We may also clean the perineal anal area front to back. Once that's complete, we'll ask the patient to be in the dorsal recumbent position with the legs spread as wide as possible. We'll put away our gloves, re-wash our hands. Position, again, the patient's in the dorsal recumbent position, and the thighs are relaxed and as far apart as we can do. We're going to wash our hands. After we've done that, we're going to grab our kit and unwrap the kit using a sterile technique. At this point, we're going to, since our hands are washed, we've got the sterile area now. We'll take our gloves out of the kit. Just for illustrative purposes, I'm going to do that here. And these gloves are not sterile. We'll use them to demonstrate as they are sterile, because the sterile ones are broken or torn. Once we open the kit, we're going to pick up the gloves by the tip of the folded in, not touching the glove, however, still the folded area. They're a little difficult to put on. They've been put on us a few times now. So I mean they're on. I'm going to fix the pinky because it's not working well, but I would not do this. Okay, once that's on complete, we're going to go to the other glove. picking up from the inside. We could do this hand too and do the reverse, but grabbing it from the inside with the sterile glove remaining on the inside. Gloves nearly on, except we've got to fix the or the ring finger. We wouldn't do this. Once those are on, we can go ahead and resume the procedure. This would be another area. Now we've got our sterile kits. We've applied our sterile gloves with our hands are washed. We're going to drape we have 2 drapes. Remaining a sterile technique, we're going to cuff and drop between the thighs, not touching the patient, remaining a sterile area. We also have a perineal cover. And we drape that over the perineal area. We also have our kit that contains our cleaning solutions, our lubricant and syringe, iodine and cotton balls. We have our catheter bag and catheter tip. We're going to make sure that that is in a closed position. We're going to go ahead and remove this at this point. We're going to dispose of that outside of our sterile area. We'll also at this point go ahead and attach the syringe to the catheter insertion. Then we would inject some water or solution to make sure that per the manufacturer the ball is inflating, and it is. Then we release that, let it go back to the normal position. Place that to the side for the moment. Dispose of the cap. And we will also lubricate that end of that momentarily. At this point, we're going to open our iodine solution, pour that on our cotton balls. Dispose of that. We're also going to take our lubricant solution, open that, pour that in the tray for lubricating the end of the tip of the insertion point. Since our cotton balls now have iodine, we have our forceps, we've got the catheter, the balloon does inflate per the manufacturer's order. We're going to commit with our non-dominant hand, spread the labia. The right hand, dominant hand, we're going to take our cotton balls, provide the pericare or medius cleaning after the labia is spread, front to back on the patient's left labia inside. We'll do from clean area from front to back, disposing of the cotton balls after each swipe. On the second one, we'll do the patient's right side. After the patient's left side, we'll do the right side, and then the cotton ball goes front to back down the middle. We'll continue doing that using any cotton balls that we have left. Once that is complete, we can go ahead and dispose of the tweezers or forceps. keeping a hold of the labia open. We'll lubricate the tip of the catheter insertion point. I've already made sure that it's closed. We're going to lubricate that. We're going to take the catheter held with our hand, insert it. The catheter, we're going to ask the patient to bear down before we're inserting. We're going to start inserting. When we reach about 5 to 6 centimeters, we may see urine flow, and we will stop at this point and make sure that there's no pain, or we would stop also if there is any resistance from inserting. If not, the patient doesn't have any pain or there's no resistance, we'll continue to insert another 5 centimeters. We'll release that and hold the tip and spot. We will go ahead and inject our fluid from our syringe, inflating the balloon of the catheter. Making a note of how much we put in there. We'll disconnect that. We'll gently pull back on the catheter, make sure it's in spot, and advance it slightly. Once that's done, we can remove our sterile gloves at this point. Wash your hands, put on new gloves, clean gloves. We'll secure the tube to the patient's thigh and position the rest of the catheter bag. Once that's taped, we would position or go ahead and secure that to the bed frame in a non-movable part. Making sure as well, once we attach that to the bed frame, that the urine is flowing freely, there's no kinks. We can coil the line if necessary in the patient's area there. While we still have our, if we need to remove our gloves and clean them, we'll put back on our clean gloves and provide any pericare as needed. We can, once that's done, we can remove and dispose of all our supplies and equipment. Again, we've made sure that the bag's attached to the bed frame in a non-movable area. We've made sure there's no obstructed flow, and we positioned the drainage bags lower than the bladder. We removed our, we can at this point remove our gloves and wash our hands. We'll position the patient for comfort, raise the bed lower, as low as in low position, raise the rail if ordered, give the patient the call light. We would educate the patient not to pull on the catheter, and if they needed anything as far as to go to the restroom, we would educate them to keep that area as clean as possible. And if they needed to go to the restroom, we could assist them moving them in the bag. Then we would thank them for letting us care for them, ask them if there's anything else we can do, thanking them to allow us to care for them. We've washed our hands, disposed of all our items. Then we can document our findings, our date, time of the procedure, the size of our catheter that we used, which was a 14-inch catheter, or French catheter, how much fluid was inserted into the balloon, the amount of the urine was in the bag, and the consistency of the urine, how the patient tolerated the procedure, and that should be it. And I may make another supplemental video for the male portion of the cleaning and the insertion.